Here is what the Congress has planned for us. This legislative approach, unlike Hillary Care, which, whatever you think about it, was at least a frontal attack, this one is a very carefully planned, incremental legislative approach. It is a pincer attack. So the pincers are going to close in, and they will cause a single-payer system. Step one was to enlarge the children's health care program and Medicaid. So the children's health care program was meant for impoverished children. Our notion of what poverty is has been increased and increased. In, for example, the Senate legislation, people who earn up to $88,000 are subsidized. The median family income in the United States, $55,000. I don't consider $88,000 impoverished, but we're enlarging those limits. Second thing, the Institute for Comparative Effectiveness. So the Institute for Comparative Effectiveness measures whether A is better than B. We don't know this. We know even from clinical trials whether a drug is safe and effective or device is safe and effective. We don't know whether drug A is better than drug B or better than therapy or better than blah, blah, blah. So now we have the Institute for Comparative Effectiveness, which will give us those results. Those are important results. Step three, now being debated, a national market that features Medicare. So if you're uninsured, you can go shopping in Uncle Sam's health insurance supermarket, and this supermarket will feature a marvelously efficient public plan that is modeled on Medicare. What is the problem with Medicare? Medicare's pricing is artificially low. Medicare, the federal government uses what's called cash accounting. It will only recognize a liability when it needs to pay out cash for it. Private companies use what's called accrual accounting. So, for example, if you have paid to a private company in the belief that you're going to receive services, they will accrue a liability for it. The liability that Medicare would have to accrue if it were a private company to pay for the services that it has promised to provide everyone in this room is $38 trillion. It does not have $38 trillion. It has got nothing at all. $38 trillion, what is that? That is 2.5 times the GDP annually of the United States. So if Medicare were a private company, it could not get away with ignoring this $38 trillion. It would have to book an expense for discharging this $38 trillion, or at least the interest expense. That expense at a very low interest rate, 3%, would add $1 trillion a year to Medicare's costs. That's $38 trillion times 3%. Medicare is cheap. Don't make me laugh. We are bankrupting our children and our grandchildren and our great-grandchildren. Now, why is this occurring? It is because the Congress does not have the backbone to price Medicare fully. Instead, what it does is it borrows from the future. That's what this $38 trillion is. Medicare recipients pay about 15% of the costs of Medicare. Now, imagine if we had a public plan. Would the Congress now develop more of a backbone and say, we're going to price this public plan fully? We're not going to do what we did with Medicare. I don't think so. Not that I am anything but respectful of our wonderful legislatures, but, you got to look at the experience, $38 trillion. Did you notice that the American dollar dropped in value when we started these healthcare discussions? That was our bankers in China they were sending us a little signal saying, are you crazy? This public plan, this 38 trillion is already in danger of bankrupting the U.S. You put in a public plan, you increase this deficit to $100 trillion or something like that, you're broke. We don't want any of your money. We don't think that this is a sound currency. So if the Congress does what it always does and underprices this public plan, the estimates are that 90 million people will move out of private sector into this public plan. We will then have the government with 30 million people in Medicaid, 40 million people in Medicare, and 90 million moving out of private health insurance. We essentially will have a single-payer system. So if the government controls it, they will control how much you can spend on health care, what kind of health insurance policy you can buy, the stores in which you can buy health insurance. Part of the reform package is Uncle Sam's Health Insurance Market, how much your doctor is paid, whether your doctor will be paid for her services to you. The government might decide virtual colonoscopy, we don't want that. We don't want to use your money to pay for that. And can you buy the drugs that, I don't mean that, the drugs you want. I mean the medical drugs that you want. So, single payer. The idea with single payer is we will reduce costs in the economy by having the government control healthcare expenditures. So how do single-payer systems control cost? Here's some data from the UK where the government runs the healthcare system. Here's some data about end-stage renal disease patients treated per 100,000. If you have end-stage renal disease, your kidneys are shot, you need to be dialyzed through an artificial kidney machine, costs about $50,000 a year. If you're not dialyzed, you're going to die because the poisons will remain in your body. End-stage renal disease dialyzed in the UK, 63 per 100,000. In the European community as a whole, 93 per 100,000. In the US, 161 per 100,000. The UK is among the top 5 wealthiest economies in Europe. Its adoption of new cancer drugs, which save lives, is on par with the Czech Republic. The breast cancer age-adjusted death rate in the UK is 26 per 100,000. In the US, it's 20.5 per 100,000. In other words, 5.5 women per 100,000 are alive in the US who would be dead in the UK. So, only 5.5 women, but suppose that woman is you, or your sister, or your mother, or your daughter. There is no question that the control of healthcare costs in single-payer systems, since they do not encourage the innovation, which is the key to productivity in the rest of the economy, has to come from controlling the healthcare costs of the sick. Now, why focus on the sick? You all know Pareto's Law. You suffered through it in your miserable Economics 101 course. Pareto's Law, a variant of it, is called the 20-80 rule. So 80% of anything can be explained by 20% of the possible causes. For example, here's one that I know personally. 80% of the beer in the United States is drunk by 16% of the beer drinkers. And as a teacher in a graduate school of business, I know every single one of them. So when business people talk about low-hanging fruit and you think, what the heck are they talking about? They're talking about 80-20. So how do you control cost? There's only one choice. You have to ratchet down on the 20% who account for the 80%, and it's a politically cruel but obvious calculus. You're only penalizing 20% of the population. 80% will absolutely love you for what you do.